computer. It's now 7:30. So, and it looks like we have a quorum of members virtually present. So, like to just make a brief description of tonight's agenda. It's fairly straightforward. I believe it's mostly for board awareness and updating. It's possible that we may need to take some actions, but I anticipate it's mostly to keep the board engaged and informed. We have another meeting scheduled Monday. I'll make a bold prediction at this point that there's maybe a 50-50 chance we can cancel Monday's meeting if there's nothing new to discuss or cover, but at the moment I'd say it's about 50-50. So with that, the first item on the agenda is an update from Cheryl. There are some new things that have occurred since our last meeting a few days ago. And if you don't mind, Cheryl, would you please bring us up to date?
Sure. So one thing, Bill, I should have given you this feedback before the meeting. I just wanted to tell everybody listening, this is a Board of Health meeting. Apparently people that are listening on the radio are getting confused whether it's Board of Health or Board of Selectmen. So they suggested at the start of the meeting, we just say that we're the Board of Health. So that's been done. So I will get into my updates. So I put two things on the agenda, but I actually have quite a bit to talk about. So we got an email today from MEMA, and they're still indicating that there's a shortage of PPE and cleaning supplies. We just received some guidance late today on nursing homes. So apparently when someone's been symptomatic in a nursing home, they have been taking them off the site of the facility to test them. National Guard is going to step in and do on-site sampling for anybody that's symptomatic. I misspoke at the last meeting. I was under the impression that all conservation areas had been posted, but they weren't. So we have been working on that this week. We've got some great signage. Bettina from Conservation and Steve Long, who's been part of our conversations, are helping put those up. So thank you to both of them. We are receiving a lot of donations from community groups for face coverings, which is a great thing. I think you're all aware that the CDC is recommending now that masks be worn anytime you go out into the public. We also have a new grocery store, an order from the governor, which is allowing only 40% of the occupancy load for the amount of people that can be in the store at one time. So that would include employees as well as customers. So we spent the last couple of days getting those occupancy low numbers from the building department, and we did the calculations of the 40%, and we sent that off to all of our grocery type stores. One of the things that's really being pushed right now is the DPH stay-at-home advisory. So I think in a lot of my messaging that you'll probably see coming out, I think I'm going to concentrate on making sure that gets in every correspondence that I'm sending out. We just want to remind everybody that, you're technically by the governor's order only to leave to leave your house for essential items. So I just kind of want to get that messaging out there. As we all know, this is, they're predicting these couple weeks here to be the worst. So, I think now's the time to really push that. So getting onto the agenda, we had construction activity. So Bill at the last meeting had heard that there was some new update from the governor for the construction, but I wasn't aware of that. But what that is, and this was an addendum that was effective April 2nd. So it's basically protocol for working for a worker that has an illness, so a construction worker that would have an illness. And it basically goes on to talk about sanitizing procedures, when they can return to work, job site exposure, cleaning, all that. So that is the newest. That's the newest update for that. So we also reached out to our building department. We received a couple complaints this week about construction sites not having proper PPE. So I reached out to the building commissioner and himself, and the building inspector will be going to visit all the sites. He passed out all our order to every person that's applied for a building permit. Some people are following it and some people aren't. So they're going to get paid a visit today and tomorrow. And, I've instructed him to shut the construction sites down if they don't have, the masks, the hand washing stations, like all their protective stuff that's required in the order. I think I talked about masks. So I think, and there was another thing. So at the grocery stores, I'm starting to see in the grocery stores, one ways. I don't know if you guys have seen that. So the stores are putting arrows in the aisles, and they're encouraging people to, go down the aisle one way and come up the other aisle the other way. And this is to be more effective for the social distancing and not requiring people to pass each other. So we're gonna reach out to the stores and suggest that they do that. And then the other area that we're seeing some kind of a concern is maybe like waiting for deli meats or getting at the meat counter. So we're also going to suggest that they put out, a lot of stores are doing it already, but we're going to suggest that they put out packaged prepackaged deli meats. So they can, people can just grab and go. So, they're not standing there for any length of time. So I think that's about it for now.
All right. Thank you very much, Cheryl. Would it be helpful, I don't know if this is permissible, but the groups that have got face masks available or that are making face masks, would it be possible, you think, to put that on the town website of where people could acquire one or how they might acquire one if they are in need? And I don't know if that violates any rules about the town endorsing any particular group or activity, but if it would be possible, that might be helpful.
See, let me make a statement, Bill. CDC's advisory is you can use T-shirts, bandanas, preferably in multiple colors. So there are things at home that can qualify as a mask.
I agree, Dr. Bill, and I have seen that, but I'll just say there's probably a small or a certain percentage of the population that may not have additional things available that could be readily made into a mask. And so I'm just trying to make it easy for those folks to find an alternative.
Bill, can I make a suggestion?
Sure, please, Mark.
What if possibly you could have a spot at the town where they could be dropped off for donations and then they could be distributed to those who request them remotely? So that way you don't run into the issue of trying to promote something or something else. It's just promote the donations and then the distribution to those who request them or need them.
Sounds fine. Anyway, it's just a suggestion, Gerald. There's some way that we can facilitate that. Since the groups are going to the effort to make the masks, then by all means, we should probably try to take advantage of it.
However, if you're wearing an N95 mask, you might get arrested because those are supposed to be reserved for the medical care providers.
Oh dear. Well, see, I actually bought mine in like a 50-pack a couple years ago, so I guess I could be in trouble.
May have expired, Bill. Can I just add a couple things to the store discussion quickly?
Sure, Mark, please.
I think what's being done is fantastic, and a lot of the stores have done a lot of their own initiatives, which are fantastic. A couple more things to consider are suggesting that they not place promotional items, high traffic areas, install more shields, try to use non-contact electronic payments, and then encourage folks that are shopping to wear the masks, not put personal items in the baskets, and to minimize the frequency of trips and the duration of their times in the store.
Very good. Thank you, Mark. And thank you again, Cheryl, for your update. This would probably be a good time for me to ask her, do members of the board have comments or questions for Cheryl? And to make this easy, I'll start by going along the gallery at the top. Dr. Taylor? You have,
No, I have nothing more to add.
thank you. Mark, are you all set?
All set. Looking forward to hearing from Heather.
Excellent. Dr. Jacoby?
I'm all set, thank you.
Mr. Cruz?
Hi, Cheryl. We had 17 cases on Monday. How many do we have now in town?
Ooh, you don't want to know, Mike. It's 20.
Yeah, I think Heather will be giving you that update, but I think it's around 25.
25. Okay. Would we want to reconsider closing down conservation areas?
So, Mike, I'll just offer, I actually put that on the agenda. It's under the special business, under update of outdoor activities.
Okay.
We have a letter from Tom Tidman addressing that, and I figured that was a good time for the board to address it. And if we want to take action, that would probably be a good spot to do it.
Okay. So you said 27, right, Cheryl?
I think 25, I think.
25. Okay.
Yeah, Heather will correct me when she starts, but if I'm wrong, but it's right around there.
Dr. Singh?
I have nothing to add.
Okay. Ms. Becerra?
I just have an anecdote to add. I ventured out today to run a couple of errands and had to wait online at Trader Joe's outside. We had a good 6 to 10 feet between people, so I could just speak to that experience that the large stores are, compliant and taking the occupancy limits very seriously. So I thought they were doing a good job.
Excellent. Thank you. That's good feedback. All right. Well, at this time, I'll ask if there are any members of the public that wish to offer a question or comment for the health director. Cheryl, do you see anybody?
Sorry, Bill, I have one call-in user number 1.
Okay.
Go ahead.
Go ahead.
Hi, it's Tara from West Acton. I urge you to keep the trails open. I agree with everything Tom Tidman's memo said. I have a couple of questions. And I love the idea of the one-way aisle. And I am perfectly willing to wait while somebody is looking at the shelves or whatever. But what seems to be happening is that, believe it or not, the employee at Donnellan, the employees that worked for this were really careful. They all had masks. But in Donnellan, half of them did not have masks. They were rushing in between people so you had 2 people that were in the same aisle, on either side of the aisle, at safe distance, but then you have the employee that wove their way around us without a mask. And so I thought that was rather disturbing. And then another time, a person was stocking the shelves and they were leaning down, and I was walking past, and they stood up, and literally their face became about a foot away from my face, and they didn't cough. But I was thinking to myself, gosh, I wish they had a mask on. So I think they're doing a really great job in a lot of ways, but I still think that there can be some improvement. And I would certainly work on the shopping markets long before I'd close the trails. And then I had a question, and I for the doctors, if I could keep on going for a moment. Would that be okay?
Sure.
So the question is this. I've only gone to the stores twice. I've been pretty good at stocking up and staying at home. And so this is the question. So say I'm in the aisle and I'm looking for something in the shelf. Somebody else comes and stands next to me within like 3 feet. And then I move to the left, and then somebody else moves into my space again, and then somebody comes along with a shopping cart. Now I'm trapped. And I don't really know what to do. And I thought, well, I would say, hey, everybody, I'm trapped. Can somebody step back and let me out? And that didn't work. People were just so focused on what they were doing. One person started looking at their iPhone and totally ignoring me. So it was sort of like a desperate moment. And I think that the one-way aisles will definitely help. But I was wondering if you had a suggestion for when we get trapped, because it happened to me 4 times. Thank you.
I see Dr. Taylor is unmuted, so please go ahead, Dr. Taylor.
Yeah, let me make a general remark. The definition of a contact is someone that's exposed to someone who has coronavirus and is within 6 feet for 15 minutes. So that's the general definition. But I think you ought to try to go as little as often to the store. Be shopping so you don't have to go more than once a week, certainly. And when that happens to you, I would just leave.
Well, I can't get out. Like, I'm stuck there. There's 3 people around me, and the other side is the shelf. So I'm sort of in this position where, but you made this point about the 15 minutes. If we're pretty sure about that, then maybe I won't panic about getting trapped.
Yeah, that's the definition of a close contact.
So what should I do? I've spoken loudly and nobody seems to listen. I
find that hard to believe.
I know, I couldn't believe it myself. It happened 4 times, twice in Trader Joe's and twice in Roadside.
I would suggest say, excuse me, and march ahead.
So say it louder, because I was trying to be really polite and all that, but I was thinking that people would know that I'm older and like at least pay attention, but anyway, I'll do it louder next time, but hopefully it won't be for a while. And the other question is, somebody sent me an article. It looked like a pretty important scientific meeting, and it was a magazine. It was about bicycles and the spreading. So the bicycle goes past, and apparently there's like virus spreading around with the bicycles. And I want to just, listen to you all think, what do you think about that?
I don't think that's an opportunity we've had for research, but I see Dr. Taylor might be able to add something.
Yeah, I haven't heard any close exposure for 15 minutes to a bicycle.
So when the bicycles go by,
I think in general in the pandemic, there's a lot of information out there. You should be checking with, more credible sources before you start saying that the tiger at the zoo is corona positive, therefore you might have been exposed, because there's no idea that the tiger can even communicate the virus to a person. So
thank you. I actually wasn't saying it to anybody. I was asking you. It's the first time I've ever, I just was asking if you heard anything about that the virus is spreading from bicyclists. So you've squashed that. Thank you very much.
All right. Thank you, Tara. All right. Well, in that case, actually, I saw a chat pop up while Tara was talking that apparently CVS is strictly enforcing the mask requirement for employees. So that's good to know. And perhaps, the grocery stores will as well.
Bill,
Yes, Mark.
I have seen some information, I don't know whether it's accurate, about regarding wearing a mask, that they're not advised for certain individuals, such as under 2 or with respiratory problems or other medical conditions. I'm not sure that they should be out anyways, but we need to be cognizant of that and tell people that they should, consult their medical professionals before wearing it if they're concerned.
Okay, thank you. Okay, and then Cheryl just mentioned that we have the Surgeon General's posting on the town website on how to make a mask. So hopefully we have some good resources for that. So at this point, let's move on to the next agenda item, which is an update from Heather of the Acton Nursing Service. And Heather, I see you're online. Thank you once again for taking the time to come and talk to us and bring us up to date. Appreciate if you could let us know what's going on.
Good evening. Can you hear me okay?
Hear you fine.
Okay. my pleasure to, come on and check in with you all. So Cheryl was close. We did have 25 this morning, but we have 26 tonight. Positive cases in Acton. Myself and Linda Cullen have been busy doing the contact tracing this week with such a big jump through the week, because it does take time to get all the contacts and reach out to them all, and then ferret them all out to the prospective towns that they live in for follow-up, and get them into the computer system. So it is a timely process, but we're managing well. My 3 nurses are ready to take, anything that comes along. We haven't had to reach out to them yet. My feeling initially was that we were going to get quite a few calls related to the mailing, and we haven't. We've had a handful. I know they hit mailboxes starting yesterday. I expected the calls to go up today, and they actually didn't. I was surprised. But they're waiting, in the wings to get that going, for them to help out. And let's see. I wanted to mention Cheryl had talked about the stay-at-home guidance and not going out except for essential items, grocery store, doctor's appointments, pharmacy. And I just wanted to reiterate that again. I think the definition of the stay-at-home guidance is really just going out for essential items or for exercise. It doesn't mean driving, town to town to town, doing different things. It really means to stay close to home, and do what you can from there. So I just wanted to reiterate that because I'm glad Cheryl mentioned it. The other thing I wanted to mention on the masks, even though the CDC has made the suggestion to wear masks, it does not mean to stop social distancing. Social distancing still needs to happen 6 feet apart, even if you have a mask on. Both of those together will help even more. So I just wanted to mention that because I think some people were under the impression, and I've had a couple of comments from folks that were looking for masks, that they didn't have to social distance any longer, but that is not true. You still need to social distance even with a mask on. So just wanted to mention that. And then just a reminder again, I've gotten some emails, I've gotten some phone calls. We cannot share identifying information on residents, and that includes deaths within towns. I just want people to remember that these are families who are losing their loved ones to COVID-19, and most likely have not seen them after they entered a hospital. So either they dropped them off at the emergency room, or the ambulance came to their house and whisked them away. And, it could be a couple of days, it could be a couple of weeks, and they haven't seen their family members, and then they pass without them being able to say goodbye. So I just want to remind people, it's very, very difficult for these folks to then see, that a town is reporting how many deaths have happened within the town. I feel as a clinician and as a human being, I feel that that's really not what we need to put out there as information. I think it's just, it's an awful, awful thing that's happening. And I just think that families need to have that privacy piece, even beyond, that their family were positive, because, the death is shocking. So I just wanted to put that out there.
Heather, can I comment on that? This is Bill.
Yes, yeah.
It's just come to my attention, HIPAA is a federal law about privacy. And also there is a state law in Massachusetts called something like the Fair Something Reporting Act.
Yep.
Called FIFA. So basically, the DPH's, I guess they talk about personal health information and confidential information, which
Correct.
also includes how it's stored. So you're exactly right. The individuals have absolute protection, and if you were to divulge their name, you would be liable for that. I mean, so they really do have federal and state protection.
Right. Absolutely. And I just think that, if there's a death in town and let's say a close neighbor knows that the person was positive and I report that there was a death in town, it's pretty easy to deduce who that is. And that's giving out personal and protected information in my eyes. There are things that definitely can identify people without saying their name or their address. So just, I wanted to put that out there just to remind people that, we really need to remember that these are people. They're not just numbers. They're people, they're families, their husbands, wives, fathers, mothers, children. It's for me, it's very concerning that people are asking for all of this private information. And of course I can't give it, but it is concerning to me that people, word of mouth kind of thing are just sort of spreading things around. So I just want people to remember it is delicate information.
Thank you. Thank you.
Sure.
I'm sorry. No, please go ahead.
I think that's it for me, actually.
All right. Very good. I just had a couple general questions, and then I'll open it up to members of the board. But have you been seeing anything in terms of the trends of cases that indicate that we're either still accelerating, leveling off, or decelerating, or is it too early or insufficient data to make any conclusions?
I would say we're accelerating as the numbers are going up. I mean, today was actually a quieter day for positive cases that came through, but then contact cases, are still rolling in at the same time. But we did go, I know Mike, I believe, mentioned earlier, we had 17, I believe, on Monday, and now we have 26 today. So we're almost 10 cases, additional in a short amount of time. But again, it's so hard to predict right now because the state numbers are still just exponentially going up.
Yeah, if you follow the Institute for Health Metrics projections, I think we're still 8 days away from predicted peak resource use, which is hospitalization.
Correct. Yeah, correct.
So, and then my second question is sort of close, but do you see any trends, like in terms of areas of town or any other factor that would, and the only reason I ask that is that would tell us what we could do better in terms of health promotion or, disease prevention activities. Is there a section of the town or a particular population or something that we should be redoubling our efforts on, or is there really insufficient data to draw a conclusion?
I would say it's insufficient data, and honestly, even if I had a particular area of town, I don't think I would mention that because it would potentially give out private information. But the ages and the locations within town are really scattered.
Okay, very good. That's all I was looking to know. Like I said, just looking to see if there was something that could help us figure out how to be better. But if it's effectively,
No, I think what you're all doing is great. Cheryl's really and her team have been fantastic with keeping up with the changes, because it does happen on a daily basis sometimes, where one like the construction stuff updating in the last couple of weeks. So it really, all you're doing is really helping out, definitely.
Okay. Well, thank you very much, Heather. I'll ask members of the board, and I'll go the opposite direction this time. Ms. Becerra, do you have questions for Heather?
I think I missed, the audio cut out when Cheryl was speaking about testing at the assisted living facilities. Did I hear correctly that the National Guard is participating in that, or my phone got a little wacky, so I didn't quite hear. So my question is, are there testing protocols at these group living facilities, particularly the ones that have elderly and disabled folks?
Yeah, that's the information that came out today, Joanne. Acton currently doesn't have that, so, which is a good thing. There's a list that we receive with the towns that are affected. That, like I said, if anybody new becomes symptomatic, it appears that they're just testing them on site, which is good because they're not taking them out of the facility at this point.
Okay, thank you.
All right. Rika.
I just wanted to know that is there Heather and her team must be following up on the individuals who are positive. Are they at home in quarantine, or any of them are at the hospital? And how many of them have improved or deteriorated? Can that information be provided?
Sorry, I couldn't unmute. So it is varied between home and hospital. The numbers are just, mixed, really. There's more people at home, I can say that,
Okay.
who are managing independently with either, their families assisting them, or delivery of groceries and things like that, friends or neighbors. So that is really good. Out of all the positives that we've had so far, because they're coming so quickly together, there is really only one person who has come off of isolation that was at home, which is great. But because everything is so recent, the 14 days or the symptomatic piece of where they have to be 72 hours without any symptoms or fever, without fever reducing medication. It's too soon to really get most of these folks, but there is one. I think it was the first positive that we had. Who's recovered.
Okay, thank you.
Thank
Okay.
you.
Next I have Mike.
Hi, Heather. Not to sound like a broken record, but how's the PPE situation?
Hi, Mike. The same as it was on Monday. I did get some homemade masks from a resident in town, and we're getting, calls from other residents. So anyone we've heard from this week, we're giving a call back to let them know that we have some homemade masks, and we will distribute those at our office, obviously with leaving them outside so they can pick them up and not be in touch with the staff. But other than that, we're holding tight where we were on Monday.
Okay. Mark.
All right, unmute. First off, Heather, thank you so much. It really is appreciated. And I know how hard you guys are all working, all your staff and all the town. I guess a couple quickie things. One is looking at the cases in general. Now we got a little bit more sampling at 26, unfortunately. Is there any information from the contract tracing that you can find where people are being exposed? Is it work? Is it certain activities to help focus some of the prevention activities?
Again, it's varied. It really is varied. It seems like in the last week, there have been more that are from work where they're exposed, is what we're guessing. But, they could have been exposed themselves they were food shopping or before they really started social distancing. It really is varied.
So it is community transmission, not from family members.
No, it's both. It's both. It's
All right.
family members, within one household, but it's also, someone in the community, either working or however they, caught this, which some of them don't really identify as a high risk. As an example, they're not identifying as a healthcare worker, let's say. So they're sort of an unknown of what put them at risk to get the disease, the virus.
Okay, and then as we're looking at things, you have some of the high risk population. You said you were seeing it across the age groups in the community. So there's no definitive trends yet there, and we haven't seen any outbreaks in those facilities that we need to address at this point.
No. Luckily, knock on wood, because I'm going to jinx myself. I have not heard of anyone within Robbinsbrook, any residents within Robbinsbrook or the assisted living or Life Care Center of Acton that have tested positive. I have not received anything from the state on those residents, which is great. But again, varied ages, young adults to older residents within town. It's just extremely varied.
It's indiscriminate and unfortunate.
Exactly.
Yeah, I guess you mentioned a point about family. I heard a heartbreaking story from DPH about where one person is affected in the family and then it's transmitted to the other members in the family, and the kids were out playing with next door because they were going stir crazy, and now they're in isolation, and it just the transmission means, and it's just
right.
And where people can be non-symptomatic and transmitting is really the point that people need to understand. Just because they find doesn't mean that they're not at risk. But
no, Mike, that's a really, really good point, because there are, the guidance changed a few days ago where we weren't tracing contacts before symptom onset. So symptom onset is considered day 0. The positive case would be, or the contact case symptomatically, you would count out 14 days from that day 0, and that would be your isolation or quarantine, depending on if you're positive or not. But now we're tracing 48 hours before positive cases are symptomatic for contacts that we are putting on quarantine. So they are recognizing that 48 hours prior to any symptoms, people have infected other people within that 48-hour time frame. So they've expanded that contact tracing of positive cases, which is concerning. But there's also been some reporting on asymptomatic people, no symptoms at all. Someone got tested because their family member was positive. They don't have any symptoms, but they're positive also. So the symptoms are so different for everyone. Some people don't get a fever, some people don't get a cough, some people don't get any respiratory symptoms, but they have a sore throat. Or people have been, and this is a strange one that I've actually seen with 3 or 4 cases. They've lost their sense of smell and sense of and taste.
Yeah.
And I've seen some things from DPH mentioning that. So it seems like some of the CDC cough, shortness of breath, fever are the most common, but then there's, some other things that are morphing into the symptoms.
Right, diarrhea, loss of smell. There's a few other ones that you've seen.
Right.
I'm sure
Right.
point to the CDC guidance, but that's why people are concerned they should be contacting their healthcare providers.
Right. And your comment about, kids playing with other kids, that was my comment the other night about, some of the apartments that we've been getting concerned residents calling with the kids running around the hallways. We don't know if they could potentially carry that. So it is not something they should be doing.
Well, obviously, the kid,
Family groups should be staying with family groups.
Carry it. Yeah, that's very disconcerting, and hopefully the education will help with that. And let us know what we can do to help, please.
Sure. Thank you so much.
Thank you, Mark. Dr. Taylor.
Yes. Heather, I'm a bit surprised that there haven't been more call-ins. The letter itself, however, makes it explicit. And if you have symptoms, you need to be home isolating. And the first recommendation is call your doctor. The second is call Acton nursing. And the third is the home isolation. And then the other, if you're well, is the stay-at-home guidelines from DPH. So, at least we pushed out the education according to whether someone's ill or not ill. And maybe
I agree.
Maybe we'll see some call-ins.
Mm-hmm.
Or maybe they're conservative because they don't want to be identified. It's hard to say in a pandemic.
No, you're right. I think that the letter was nicely worded, very easy to understand, the steps they should take if they're symptomatic and the steps they should take if they're not. So I think it was very self-explanatory. There's been a couple of questions which I think are good, and they're good questions. I think my most concerning question was from an older adult in the community who cares for her husband, who she doesn't know what she'll do if she got sick. And that's concerning. People need to have a plan in place if you're a caregiver for a family member, children, that you may or may not have other relatives that are around that can help out.
Exactly.
It is concerning as a caregiver to hear people say that.
I did want to make a comment about a pandemic. A pandemic, you're not looking for a source. I can give you let's say before the pandemic, a group of people went out to eat at a church picnic and half of them got sick. The epidemiology of that is you identify those characteristics and you're suspicious that it was a common foodborne source that they experienced at a meal at a church picnic, perhaps. But in a pandemic, you can get exposed anywhere. And looking at where you live may be totally irrelevant because you drive around to public facilities and elsewhere. So what we should be focusing on is not, half the cases are in part of Acton. We need to make sure that when people are positive, their contacts are identified within 48 hours and those people are quarantined.
Mm-hmm.
That's how you break the back of a pandemic.
Right, absolutely.
25 out of 24,000 people, rather small to make any conclusions. But I'm much more interested in making sure, that Heather's got the resources she needs because she is following the context of positives. And as we also mentioned in the letter, household members have a much higher risk. It's about 30%. So you can do a lot of, violating social distancing, you still won't reach 30%. So household members are at very high risk, and they will be identified as you identify and talk to the contacts.
Correct. Yep.
So the key work is getting people into home isolation or into home quarantine. Unfortunately, physicians are not reporting, hospitals are not reporting. They may be reporting to DPH, I don't know. But the positives, I think, so far, Heather, that you receive are laboratory positives. Is that correct?
Yes.
Yes.
I have had a couple of clinically diagnosed positives
Okay, good.
from physicians that I've followed up on.
Excellent. Because in a pandemic, if you have a cough and fever, your risk of having coronavirus is much higher, just based on those symptoms.
Correct.
So I think we're doing the best we can. If people call in, those will be a bonus because that's definitely community transmission.
Right.
Thank you, Dr. Bill. Dr. Jacoby.
Yes, Heather, I just had a couple of questions for you. I had a friend who has two of the symptoms. I suggested he get a hold of his doctor. He did at Acton Medical. They gave him a test, or rather he took a test, but they said it would take 2 to 4 days to get the results. Is that typical, or is there some place that somebody can go to get a faster result?
No, that's pretty typical. We have been seeing in the last maybe 5 to 7 days some testing that is coming in faster, and I don't think I can identify if it's a different lab because everyone is getting tested different places. But it can take up to 2 to 4 days. 2 weeks ago, it was taking 7 days plus before any results were coming out.
There is a new test available, and I've learned that CVS has been coordinating a drive-in testing site in Lowell, Massachusetts. They are not testing anyone that's asymptomatic, only people with symptoms. And you have to go through CVS to get a number. So you can drive in, and the waits are probably several hours, but they will be able to tell you if you're positive or negative while you're there.
Okay.
I had not heard they were doing that.
Yes.
Good to know.
Yeah, I just had just one more question. I suggested he also call the nursing service. He said he did, tried for about an hour and wasn't able to get through. I mean, I don't know if that's fact or fiction, but is that what's happening?
No, our phones wouldn't be that busy. We have multiple lines, so I'm not sure if he was calling the right number. Because I think we have 4 lines that come into our office, and
Okay.
once there's 4, I think it's 4 lines. Once the 4 lines are being used, then no other calls can come in. And honestly, the only time that ever happens where people get put right to voicemail is on call-in day for our podiatry clinic, to be honest. So
Okay.
it doesn't happen often. If you could have him check the number and, give us a call, that would be great.
Is your number published? I mean,
It is. It's on
the
the
letters.
website. Yep. It's on the letter also. Yes.
Okay, thank you.
Thank you.
All right, thank you. Heather, excuse me, not Heather, Cheryl, at this time, do we have any questions from members of the public?
Yeah, I have one. T.
Okay, please go ahead.
Go ahead.
Hi, thank you. And I just want to let Heather know that her speech about the privacy and her sensitivity to the families experiencing this was really heartwarming. It drove me to tears. And I just want to thank you, and I hope that you are finding a way to engage in self-care yourself. I was going to ask her a question about hospital capacity at Emerson. And I want to make a comment about the rate of growth appears to be flattening in both new cases and deaths, as though, it's 10% a day is not great. And I also want to say that my friend got tested in Lowell and didn't take that long. And she got the results right away. Thank you.
Thank you. Okay, at this time, let's move to the next agenda item, which is an update on outdoor activities and a discussion of the letter from Tom Tidman, their they're pretty much both related. So Cheryl, over to you.
So when Heather was talking, it reminded me of one update I should have given you earlier. It was we did reach out to all the property managers of the apartment and condo and sent them information for posting and for emailing their residents, pretty much giving them the guidelines to social distance and to stop, sending their children out to play. So just wanted to let you know we did that. So as far as NARA closure, so the next day after we met, which would have been Tuesday, we were able to get Jersey barriers blocking off the parking lots. We got closed signage up there. And the police are really helping us out a lot, and the person that's stationed up in that area is driving through there a lot. Have not had one complaint from there. So if you do drive up there, and you'll notice the Jersey barriers on every area except the upper parking lot. So fire pointed out to us that is a landing zone for life flight if needed. So there's more of a temporary barricade into that parking lot, so the fire trucks could move it if they had to. And then the areas of the parking lots are Jersey barriered. So I just wanted to tell you that in case you happen to go up there. But like I said, so far so good, no complaints. I've seen a lot online of positives about the closure, and we received a couple complaints about it, which we've responded to and haven't heard back. So I think people, are getting it, which is a good thing. Do you want me to follow into the conservation?
Yes, I think that'd be fine.
Yeah, so I reached out to Tom at your direction and asked him his recommendation for keeping the conservation lands open, and he's recommending that we keep them open, quoting that people there are social distancing, and how some people are needing these areas for their mental health. So we are not receiving complaints for these areas at this point. So it seems like it seems like we're doing what we started with NARA, right? So getting the signage up, ensuring that people social distance. It seems like it's working for now, right? You just never know when it's going to change, because we were hoping that what we did at NARA was effective, and it wasn't. So, but that's he definitely thinks it should be open. We can, if the board wants, we can further implement. I've had a suggestion that maybe, like with the Arboretum, that we make it one way. Go just like a grocery store. So one way, everybody has to go to the right to start and come back around and go to the left. It's just something to throw out there to you.
It's not a bad idea. Let me ask for comments and questions from members of the board, and I'll go in the opposite direction again. So that means I'm going to pick on you, Tom.
I believe that conservation land should be left open. I've been on conservation land, and there are not a lot of people there. There's good spacing in between. As far as the Arboretum, you do have people who walk, but there's a lot of people who just sit on the grass in small groups. It looks like families or young people who are, for all looks to be, sitting 6 or 7 feet apart. So I think leaving the Arboretum and the conservation land open is what we ought to do.
Okay, thank you. Dr. Taylor?
Yeah, I agree with Dr. Jacoby.
Okay. I have to move my screen here. Next up, Mike.
Hi, Bill.
Hi, Mike.
So the increase from where we were at, like on Monday to now, is concerning. We're up to 26 from, I think, 11. And I would also note that today in Massachusetts, we had an additional 2,151 new cases of COVID-19 and an additional 70 deaths. So my view is anything we can do to shut this down would be beneficial to the community. I think we should limit access to the Arboretum and conservation areas.
Okay. So Mike, I'd like to just make a suggestion. I'm gonna let the other board of members speak, and then I will circle back to you and see if you wish to make a motion. Does that sound fair?
Fair enough.
Very good. Rika?
I, in a way, agree with Mike because if we try to limit the numbers at this point, the situation would be much better for everyone to go out much sooner than waiting. So that's my view. But I agree with the people who can maintain distance, but then again, there is always a risk.
Okay, thank you, Rika. Mark?
Trying to unmute. I guess there's a lot of issues. And first, I would say we probably need to differentiate three different areas. The wide open conservation areas are very sparse, 1,900 acres. So that's the least of the concern. The bigger issues are going to be the Arboretum, where it's a gathering spot. People mostly drive there for their activities, and for the rail trail, which is very narrow. And again, you have a lot of interaction. So I think differentiating the Arboretum and the rail trail from the conservation land is probably advised in the discussion. But I think we need to go back to the beginning. Right now, in the last 2 weeks, we've seen more than a 20-fold increase in the number of cases. We've seen a dramatic increase this week. So what that tells us is we're in a very challenging period, and we need to probably take more action now than later. And I think it's very clear we're getting a lot of mixed messages. Get folks, get outdoors. Well, I need to have recreation. And I think we need to go back to what the Department of Public Health stated in their advisory about the order. They said residents, are supposed to stay home. And they make a very good point. They said in the order that, I have to look it up, but the point is that they're not, recommendation is that for gatherings of more than 10 people, which would certainly be in those areas like the rail trail and Arboretum, they're unenclosed spaces. While permissible, they're not advised. DPH is clear. They do not advise people and individuals to go there for their recreation. So I think the Board of Health should be very explicit in saying we support the Department of Public Health's guidelines and strong recommendations that they're not advised activities. So when you look at it's not advised and you see 20-fold increase and very substantial increase in the last few days, it's very disconcerting. So I think if we can take baby steps to try to minimize the contacts in those spaces, I think it would be great. One-way trail use face masks, limit the access so they reduce the capacity, just like the supermarkets. Though I think those are good first steps for the Arboretum. For the rail trail, that's much more problematic. You can't really do one way. But those bike lanes are 6 feet wide. So unless half of the trail has to be unoccupied to maintain the 6-foot spacing. So I think we should probably consider this recommend. I'm sorry, I didn't hear a comment. So I guess I'd like to see some guidelines and recommendations to have folks try to use it appropriately to maintain the spacing. Have people do their activities, single file, stay to the edge of the trail, minimize contacts. Those are just some basic things. I think we should also, consider possibly limiting the amount of parking so we actually have reduced capacity. I'm concerned with the nice weekend. We'll see what happens. I think put those guidelines in. If we have a situation where we continue to see the rapid escalation in cases and transmission and the lack of the ability to control that situation, then it will be inevitable the next step. That's not what we want. Hopefully the community education will be appropriate. Stay at home, keep 6 feet. Use the recreation areas only when you do not have an opportunity to do so at home, and stay local. So I guess those are my comments for the moment. Education, ask people to do it and make a clear message. Stay home, and it's not advised.
Okay, thank you, Mark. Joanne?
I appreciate Tom Tidman's letter to the Board of Health. And I think, Mark makes a good point of differentiating between the paths in the woods versus the more less woodsy arboretum and the rail trail. And I think that once, if signs go up, that'll be helpful. I think if people are encouraged to wear masks and be reminded of social distancing, that would be very helpful. I like the idea of seeing if we could get the Arboretum folks walking in one direction. I know they do that over at Walden Pond, so I suspect we can do that with the main loop in the Arboretum. So those are, good suggestions, and I appreciate Mark's input on that.
Okay, thank you, Joanne. So actually, I haven't shared my opinion yet, so I'll, normally that's unusual for me. I guess I'm very sensitive to the increase in number of cases. I would point out, though, as someone mentioned, it's still at 1 in 1,000. So the trend is obviously not our friend, but still the impact is somewhat modest. Also, as we're getting more identified cases, it means that we're actually, I think, and Heather probably has much greater insight into this, or Rika, but I think it actually means we're starting to get a handle on things, because once we understand who the folks are that are sick and we are able to isolate them and so they can transmit it to other people, hopefully the rate of transmission will start to level off. So that is sort of the basis for what I'm going to suggest, which is, I think on balance, leaving the trails open, as Tom suggests, is probably worthwhile at this point. I very much like the idea of making them one way when possible. I also like the idea of putting up a sign that says, please wear a mask when you're on the trail. I think both of those are great ideas. I think that's a little bit in line with what Mark was saying, was why don't we see if we can attempt to further lower the risk of using the conservation lands without restricting them. So that's my 2 cents, but I promised Mr. Cruz that I would give him an opportunity to add something further if he wishes. So this is your opportunity.
Can I interject, Bill?
Sure.
I think people refer to the number of cases, and then for some reason there's a fixation on, gee, it must be the Arboretum, or it must be NARA, or it must be the conservation land. Now, the problem with 25 cases, we could call them all up and say, did you go to the conservation land before you were ill? Did you go to the Arboretum? The problem is everyone's busy working the contacts, so they don't take a full history of the case. So when you are looking at the case numbers, you have no idea that that's reflective of people using the conservation land. how many people in town walk in the conservation land in a given week? I don't know, probably less than 1%, maybe 5%. So the problem is when you can't determine what the real risk is, people, what I would say, fill in the blanks. Everything's high risk. And if the cases go up, then let's ban everything. And I think that's a little bit irrational.
Okay. Thank you, Bill. Mike, you have anything further to add?
No, I think any motion I would make at this point would probably be voted down, but, my view is we really should close everything, but Mark, if you would like to make a motion, I'd be all for it.
I guess,
Sorry about that.
do you want to go ahead?
Can I just add to it? I just wanted to point out, like, if we look at the curves in the countries where the cases happened nearly at the same time as it happened in US, and those countries which were very strict in terms of asking the people not to come out or not to go out that much, their curves have gone significantly down. So that should tell us something.
Okay, thank you, Erica. Mark?
Yeah, I guess I'm very cognizant of the impact to folks. And as we point out, we have folks that are asymptomatic going to areas with a number of people. And that's the concern. Not out in the middle of 1,900 acres of conservation land, but on the rail trail where there's a lot of close proximity, and in the Arboretum, which is kind of a park. So I guess I would advocate right now we put in measures to try to reduce the risk, try to encourage people in the strongest way to stay home, and that use is not encouraged. Well, it's permissible, it's not advised. That's what DPH keeps saying. So I think the one-way trails, I think trying to reduce the capacity, encourage people to use it at different times, to come back, to shorten the visit, have like the Arboretum and the rail trail for transitory use. It's not a picnic area. We don't want to encourage that. Not to touch hard surfaces. I think the other two things I forgot to mention were make sure people take any trash in, they take out, and to keep their pets on a leash so you don't encourage interactions. So do steps to try to make it so that we've reduced the risks while still allowing it. It's not advised, but it's permissible according with the DPH guidelines. If we see non-compliance or problems, or if we see substantially increased of transmission in the community, then I think we need to reevaluate it. So I would say probably look at what this weekend brings. Last weekend was very bad at Dara. Let's see what happens in this area. Reevaluate it on Monday would be what I'm suggesting. I think Mike and Rika make good points. We really do need to look at this, but there are a whole bunch of other things that need to be considered.
Okay. Thank you, Mark. So I'm just going to suggest to members of the board, we do not have a motion at this time, but we certainly have some very good suggestions. So Cheryl, I'm just going to ask you, it sounds like there is certainly board consensus for implementing as many, I'll call it beneficial practices that will help reduce the risk of using the conservation areas even further, such as the one-way trails, suggestion to use a mask, the suggestion that the trail use be limited duration, that the best advice is to stay home, try to limit the parking areas, that sort of thing. Do you feel you need anything further from the board to talk to the Conservation Commission about implementing those changes?
No, I can pass those on to them. The sign that we already did is, includes don't touch, wear a mask. It includes a lot of the language we just talked about. So the sign that is about to go up at those areas. So that's a good thing. We don't have the one way on those. So we'll have to figure that out. If I just looked here, David Martin just mentioned in chat that the rail trail is actually 12 feet wide. And
That's correct. It's 6 feet in each direction.
yeah, I'm just throwing that out there. But we can handle this. So I just want to make sure. I mean, we're going to get a motion, right? Are you seeking a motion?
No, I actually suggesting that we don't need to make a motion, and if you feel that you've got the sense of the board is and can carry it forward, we're
Okay.
probably good at this point.
Okay. So limit duration, one way, limit parking. Put out guidelines that it's stay at home, right?
So, Dr.
Can I make a comment, Bill?
Yes, please.
I want to talk about the rail trail. My information is firsthand. It's not anecdotal because I'm out there a lot. I've mentioned before that what I see is family units or individuals walking alone, keeping the appropriate distances. But even if you wanted to shut the rail trail or limit it, I think you need to consider what the rail trail is. There are, I think, 4 official parking lots. None of them have more than 25 spaces in them, maybe double that if you consider Isar's Pond. So you probably have about 150 parking places along the whole rail trail. So if you have 2 people in a car, that's 300 people spread out over 8 or 10 miles. There's not a lot of density. So in fact, most of the people that are on the rail trail do not come in through the parking lots. They come in from the street crossings, they come in from the subdivisions, they come in from public and private parking lots, they come in from stores, they come in from homes, they come from Carlisle and Westford, particularly the section of the rail trail from the bridge over 2-way down to Teamworks. About 2/3 of that trail is completely open to streets and stores and parking lots and neighborhoods. So as a practical matter, even if you wanted to close the rail trail, I'm not sure how you would do it without running a yellow tape for 8 or 10 miles. So I think hanging up signs, the other day I was there, I mentioned to Cheryl that there were no signs. So hopefully if we put up signs and make it clear, have pictures of what you're supposed to wear, how to wear your mask, I hope and think that will be enough, because I think even if you wanted to close the rail trail, I'm not sure how you could do it.
There's a comment. West Boylston already closed their rail trail because they've had problems. But it is a practical matter. But I think we're kind of missing the essential message. The essential message is folks are advised to stay home, and recreation at these facilities is not advised. I think the board needs to be very clear on that message. And that's because that's what DPH is asking. I would suggest we affirm that message to the community so they understand. It's not, hey, that's where I'm going for my recreation. It's, we're not advised to do that.
Thank you, Mark.
But the state has not made any order statewide.
Yes.
I think there was one state that did that. I can't remember which one. The governor banned use of any public parks in the state.
I think it was Chicago, but I'm not sure. But what I'm saying, Bill, is the Mass Department of Public Health advisory on the stay-at-home order specifically stated that in the advisory information, it's gatherings in unenclosed outdoor spaces such as parks and fields or parking lots, while not permissible, is not advised. And that goes back to the community transmission issue.
So if I can just sort of bring us back to a closure. Cheryl, that I think you have a sense of what the board is looking for. Would ask if you could communicate that to Tom and his land stewardship committee. And also if you could ask that they keep us advised as to what they're seeing, and at our next meeting, whether that's Monday or Thursday, let us know how that's working out. So given that, I'm going to ask what I'd propose. I'm going to ask members of the board if that accurately represents what they feel is our guidance, and then I'll ask for comment from a member of the public. So members of the board, Dr. Taylor, I see you up first.
What is the sense of the board? What Mark was discussing?
Well, actually, it's kind of what I just said.
Okay,
I was proposing that was the sense.
all right, that's fine. I go along with that.
Okay, Dr. Jacoby.
I go along with that too.
Mark.
I'll go with what I stated.
Okay, Counselor. Mr. Cruz.
I'm good.
Rika.
I agree with what you stated.
Very good. Joanne?
I agree as well.
Okay. I think we have at least a sense of the board. I ask Cheryl, they're members of the public, and just apologize. I mean, Tara, you did make your comments earlier. I think we know how you stand, but are there comments from members of the public?
I have Tara and Steve and Long. I'll let Steve Long talk.
Yes, that's fine.
Go ahead, Steve.
Hi, thanks, Cheryl. Thanks, board members. So I greatly appreciate the tiered approach that you're thinking about. And I greatly appreciate conservation lands remaining open. I would just offer a couple of things to consider. One is, when I read through everything that the state is putting out, when I look at the governor's advisory under the questions and answers section under essential services, it asks a question. It says, are parks, hiking trails, wildlife sanctuaries allowed to stay open if they enforce proper social distancing measures? The answer is yes. So I appreciate the comments about DPH advising people to stay home, and just am offering the governor's perspective as well. And I just want to say also that I really, really appreciate Cheryl. I've had a whole series of volunteers that are working with the Natural Resources Department, and we're going to be posting the signage as people who are avid outdoor walkers and hikers on conservation land. So we have a core of volunteers that are donating the laminating papers, the printing, and we're also going to donate the labor to post the signs at all trailheads and on all signs. And if there are no kiosks or trail markers, we'll find a way to put them on trees. So I just wanted to express appreciation for the collaboration between Board of Health and Natural Resources. And I just like you all to consider some of the unintended consequences of some of the policies that you consider. So if you do decide to limit parking, people are just going to park in neighborhoods and not in the appropriate conservation land area, which may create a safety issue. If I think of the trailhead at the Jenks land off Central Street, there's very few spaces there. So if you limit or close that off, people will be parking on the side streets or on Central Street, which doesn't seem safe. I'd also ask you to consider the unintended consequences of closing all the trails. People want to walk. And if they walk on sidewalks, they'll be much closer to each other than they would be if they were either on the conservation land trails or the bike path. So I think having areas for people to walk is a great idea. And I think conservation lands are definitely safer, in my opinion, safer places to walk relative to COVID than sidewalks and perhaps the bike trail. Although I do respect what Dr. Jacoby says, I haven't observed what's happening on the bike trail myself. I'd also say that trustees of reservations just decided to open their more remote properties today. They have 70 properties across the state, and they've now decided to open their more remote places that don't have facilities and don't have staff and don't have educational programs or historic preservation attributes, like the Manse in Concord. So there's a trend now to statewide conservation organizations opening their properties. I work for the Nature Conservancy, and we have 33 conservation lands. We're in the process of reopening ours that don't pose risks to people, where people can pass each other safely. We have some that are preserved for biodiversity that have very narrow trails, unlike the trails we have here, that would be inappropriate for people passing each other within 6 feet of distance. So I greatly appreciate the pressure you're all under. I myself am appreciative of all the work you're doing to keep Acton safe. Was very touched by what Heather had to say, and I just want to thank you for what you're doing, and want to offer myself as a resource, as a partner, as a collaborator on how we can have folks in Acton get out safely. So I've been in dialogue with the state agency folks and with statewide conservation organization people who are giving this issue a huge amount of thought. I was on an hour-long conference call today on this very topic with the environmental secretary and others. So if you want to use me as a resource, please do for that type of work, or for volunteering and corralling people to help do signage or do education or do whatever is needed to do to keep the conservation lands open. So thank you.
All right. Thank you, Mr. Long, and thank you for your support to Cheryl and with Cheryl for helping with the lands in town.
You're welcome.
At this point, Tara, do you have anything to add in addition to what you've already said before about the trails?
Yes, I do. I don't want this answered, but I just want to have somebody think about it. That if you want to close the trails, where do people go for recreation? And I just want you to think about that. Because if you want to close the trails, offer another proposal. I love the one-way idea, and I am certainly coming around to the limited parking to limit capacity. If the signs explain about the capacity issue, and it has a sign on the sign that includes a link to the actontrails.org for alternatives, and a notice to people that say, if you don't stay apart, the place will be closed. And I think that's important. And the last comment is that I watch the numbers pretty closely every day, and it looks like all the countries have gone significantly down, almost equally, depending on the time in which they accelerated the most. So they accelerated early, they're going down early. And the places that have lockdowns, I don't think are going down any faster than anywhere else. Thank you very much for letting me speak again.
Thank you. Okay, so I believe we've brought this item to a conclusion. That brings us to the last item on our agenda, which is the minutes from April 6th. And I'll just offer that I read them, had no comments. I ask if any of the other members of the board have comments on the minutes. I'm not seeing anyone unmute, but
None for me, Bill.
okay. Thank you, Mike.
Me neither.
Very good. Thank you, Joanne.
Nothing.
Well, in that case, if there are no comments, anyone care to make a motion?
So moved.
Thank you, Mike. Is there a second?
I'll second.
Very good. Joanne, I think I heard you first. So motion made and seconded to accept the minutes as written of April, make sure I get this right, April 9. April 6th. Today is April 9. All those in favor, please say aye.
Hi.
Aye.
Very good. And I'm pretty sure I heard at least a majority of the board, and I'm also aye. So I declare that the motion succeeds. In that case, I believe we've reached the end of tonight's scheduled agenda. I ask if any of the members of the board have anything else they wish to bring up. Suddenly, my face just got far larger on the computer screen. Gonna have to spend more time in makeup before these sessions. So, does anyone else have anything they wish to ask, add, or comment on for the health department?
Yeah, I would just say, Cheryl, I'm really impressed at all the work you're doing. You know, we spend an hour and then you have to spend many hours and follow up. And thank you for that.
Yes, indeed. Certainly echo that.
Thank you guys. I mean, I have a great staff. I couldn't do it without them. So we're all teaming together and getting a lot of work done. And you're right. Right after one of these meetings, it's like hours of work, but that's okay. We're good.
All right. In that case, I guess just ask if there are any final comments from members of the public. No? Appears there's none. Okay. Dave, we haven't had a chance, given you a chance to speak tonight. Do you have any questions or comments?
No, nothing really. I'm happy with all the the varying points of view on the trails and the conservation lands. So, thank you.
Okay, thank you, and thank you for representing us well to the selectmen. I know that was probably not your desired.
No, I think that's good, and I think that we have to be all together on this. I think we, the standard for going forward in my mind should be, if we did something like close the conservation lands, do we really expect that would stop the transmission of the virus? And I think that's a big question, or even stop even one transmission. And I think that we have to consider things too, like Heather said at the beginning, or in the middle of her status, that there's some apartment complexes where children may be running around together or playing in the hall together, and I would point out that for those of us who are in single family homes, it's easy to go in and run around the yard, but for someone in a 3-room apartment, that's not so easy. And you can't have your kids go outside, and because there are other kids outside, right? So, when I walk the conservation lands, if I run into people, which is not always, and I walk some conservation land daily, really, and they're often family groups, and that's the only time they get out, and they don't have any place else to go. So. Everybody's very polite and steps away from each other.
Okay, thank you, Dave. I think we've reached the conclusion for tonight's business. Any member care to make a motion to adjourn?
Bill, before we finish up,
Mm-hmm.
I think 2 quick comments. Thanks for everybody's input and comments. I think we really do need to separate the rail trail and arboretum as closed spaces from the conservation lands. They're 2 different situations. So I think that really does need to be made clear. And the other comment was, we have a lot of information about new guidelines for supermarkets. The question is, going forward, we should check to see if there's any other stores, essential stores that are open, whether or not those need some of those similar type of guidelines or recommendations for capacity and things like that. You're shopping for other things other than food.
Okay, thank you, Mark. And if nobody has anything else, I'll be happy to make the motion to adjourn. Very good. Is there a second?
Seconded.
Very good. We have a motion made and seconded. All those in favor of adjournment, please say aye.
Hi.
Aye.
Aye.
Very good. I've heard a majority of the members, so I declare the meeting adjourned. Thank you all again. I do sincerely appreciate everyone's time. everyone has been very diligent about making every meeting. Very much appreciate it. And next meeting is scheduled for Monday. Like I say, if there's nothing new to report, I would anticipate canceling it. But if there's certainly of any new information or new protocols that we need to discuss, we'll go forward with the meeting. Thank you. Good night, everyone.
Thank you. Good night.